most famous physical therapist on the internet.
Hi folks, I'm Bob Shrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about the top 5 exercises to do before knee replacement. This could probably actually be done before a lot of knee surgeries, especially if you're having knee pain right now.
Sure.
So we don't want to exclude anybody. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And by gosh, you're going to want to go to bobandbrad.com this week, because this week we're giving away a Sleepovation mattress. And look at the individual mattresses and the channels here. And this is only a sample of one.
Yeah, they're normal sizes.
Yeah, they're normal sizes. Go to bobandbrad.com, go to the program section, the giveaway section. There we go. Then you can also go to Facebook. It'll be pinned to the top of the page. Go to Instagram, Twitter, or TikTok for a 60-second version of our program.
There you go, Bob. Thank you.
So before surgery, as much as possible, you want to improve your strength and range of motion. You're going to get a better outcome. But while you're doing these exercises, we don't want any sharp or stabbing pains or shooting pains.
Right.
You know, stop if you're feeling that.
We call this actually prehab.
Sure.
Rehabilitation prior to surgery, very important.
Yeah. A lot of times what we might have you do before you do these exercises, you might just walk a little bit to warm up the legs,
right?
You know, for a few minutes, just so that make sure the muscles are moving. The first one we're going to start off with is a very simple one. We're going to need a chair with the arms on it. And because your legs are sore, what you can do is, I don't want your knees bent beyond 90 degrees. I want it to 90 degrees only.
Right. So that's that right angle.
Yeah, right angle. And while you're in this position, what you're going to do is you're going to use your arms, but I'm also using my legs. So I'm just getting some strengthening here.
Right.
And a lot of times, actually, if you could try to hold yourself up on the way down.
Now,
so this chair is a little bit low for me, isn't it?
Right. You know, if it is too low, you can put a cushion or a pillow or two underneath.
Yeah, that's better.
That'll make a big difference.
Yeah, that's much better. So again, very gentle. Most people can do this. If the side hurts, take a little more pressure on your arms.
Yeah.
But it's just a good warm up, good start. 10 times, 2 times. We're going to have you do all these like 10 times, 2 times a day.
Right. You can actually shift your weight and put a little more weight to your good leg with that as well, if your other one is
right, exactly
weak or painful.
All right, all the other ones are going to be done in bed to some extent.
Sure.
Brad, we'll finish with the knee glide and the foot glide on the chair too.
Yep.
But why don't do you mind starting with, we're just going to do a straight leg raise supine.
Sure.
So he's laying flat on his back.
This would be the sore leg.
The valve leg.
Yep.
Yeah.
This one, it helps if you bend this knee and bring this up. It takes pressure off your back. They just go much better if you do that. We're going to lift up. You're going to straighten your knee out the best you can and lift up with good motion control. Get up to about the height of the other leg is fine, and then back down. And we're going to do 10 of these like Bob had mentioned.
So basically you're strengthening the quadricep in an isometric manner.
Right.
And it's almost everybody should be able to do these. Now, you may get tired, you may get fatigued, but try to work yourself up to 10. Again, 2 times a day.
Exactly.
Short arc quads. So this, all you're going to do is you're going to take a roll towel. A lot of times people take a coffee can and put a towel over the top.
Yeah, if you can get one of the metal ones. The plastic
right.
can squish a little bit.
Well, also, I guess somebody mentioned a 2-liter bottle and putting just some toweling around that would work too.
Anything about 6 inches in diameter or so, it's not real critical.
So now you're doing just some short arc quads, and this is one that you start off with. And you're tightening up, and eventually you might even be able to put a little bit of weight on your ankle.
Sure, you bet. And really, this is one of those things that you may not be aware of, but you can feel those quadriceps tighten up. And if you do that before surgery, after surgery, you can do the same thing. And just because those muscles are not going to want to
they're not going to
fire
activate
after surgery because of the surgery.
Yeah.
So that'll just be it's a good prehab exercise.
Yeah, you'll be ahead of the game. And you could just take your purse, put it on here, especially if it's heavy. Some ladies in her purses, they wouldn't even be able to lift them. So, all right, short arc quads, 2 sets of 10. Now we're going to just we want to make sure the knee has as much range of motion as far as straightening is concerned. So we're going to go ahead and just take that roll towel and put it right underneath the foot or the ankle so that it's comfortable,
Right.
and just let gravity do its thing. I mean, it's a good 1 to 2 minute stretch.
Right. You may not even be aware that your knee doesn't straighten. You know, if you put both legs together, you might see that this one drops lower than this one. And so we want to eventually get that range of motion till it is straight. It's going to help your rehab after surgery.
Yeah, the point we're trying to make with all these are very simple exercises to
Mhm.
do, and really no excuse for not being able to do them, but they're going to help you in the end.
Yep.
So all the ones we've done so far, 2 sets of 10, except for this one, you're going to hold for like a minute or two.
Yep.
So, and I'm going to grab the. Do you want to start with the knee glide, Brad, or fit glide?
Well, Bob, let's go with the.
Probably the knee glide.
Yeah,
Huh?
that's what I was thinking. I'm going to take my shoe off.
Oh, we need a towel too.
App
Mike, you want to
represents-
grab a towel?
Because, you know, the nice benefit about this is you can do these laying down, and after surgery, this is a big benefit.
Yeah,
If
you're
you
going to
can-
want to have a knee glide after surgery because what we're going to want to work, Mike's going to throw a towel in. This is going to help you get your bending and straightening and strengthening all in one. And how are you sitting, Brad?
Good. That's good.
So what's nice about this is obviously you can work on it while you're in bed. And so after surgery, you can get a head start by doing it in bed, and then eventually you can go to on the floor.
Yeah, right in the hospital bed. And then at home, of course, it's really nice and smooth. If you don't have one of these, there's not a good option. You can try and slide your foot on the bed sheets, but they wrinkle up.
Not going to work very well.
Yeah, it does not work well.
The other thing, if you need some help right after surgery,
Yep.
just starting to get a little movement,
Yep.
you know, nearly anybody can help you do this.
Yep.
And
And sometimes you can help yourself, you know, with your hands, you know, if you can finagle things or put a towel roll around your knee.
now, if you want to go with the premium version, so that was the knee glide. And by the way, it's very lightweight. It's 3.1 pound,
Yep, that's what this one is. That one's just right around 5 pounds.
around 5 pounds. And what's nice about this one is afterwards you can actually use it to do exercises too. You can actually keep your knees fit by if you
You
so-
can, you know, work the other knee as well, so that doesn't get stiff.
right
Because if you have some arthritis in your other knee, staying still is one of the worst things you can do. I had one person, a friend of mine, he went in the hospital, kept his knee still for a different procedure, and his arthritic knee got so bad he had to wear crutches for just after being in bed for a day and a half.
Sure.
Completely motionless.
Yeah, it's arthritis does not like to be still. Joints like movement.
That's right.
So anyway, this is another nice option. What you then can progress to is actually doing some on the floor here, and
like in a chair, obviously.
chair,
And
right.
it could be a wheelchair after surgery or at home in any one of your chairs. Typically a firm chair, not a piece of lounging furniture where it's soft and cushy.
now the advantage of this also is that you can get a little bit of help by putting this stand up.
Right.
And so it's going to help you in deflection, but it's a little harder into
Right.
extension into quadricep. And
Now,
then,
if you don't have one of these, you can put a towel
yeah,
on a floor as long as it's a smooth, shiny floor, so that
Right.
works. You know, that's a traditional way.
and then this goes the other way too, and it actually works the hamstrings a little more.
That's a really nice hamstring device for the points in the rehab.
So after you've had surgery, we generally recommend like 3 times a day for 5 minutes.
Yep.
It's up to you. You could go 2 times a day for 5 minutes as you're preparing. It's all going to really help. And I think we've gone over this enough, Brad, but they probably understand that the fit glide is going to work the same way again. It's going to allow you to work both legs at the same time while you're
Right.
seated,
Yeah.
and you can get a little bit of workout.
Sure.
I always point out with this,
This also has.
yeah, it has a stilt that way. I want to point out with this, Brad always gets upset when I put this out. There is a little bit of swoosh swoosh sound. So
Yeah, but it's not like a stationary bike or a
no,
treadmill.
no. But it's not silent. There
Yeah.
is a little. So if you're going to be in your office or something with other people, they're going to go, "What's that sound?"
Yeah.
So, and again, this goes this way too. So we just we're really proud of these. We think they really serve a great purpose.
Yep.
And
exactly.
our patients have done so much better when we send a knee glide home with them.
Right.
And so
I've had patients say when they come from the hospital and I start using that, they say, well, why don't they have one of these at the hospital? All we got was
a towel.
a towel to put on the floor. And it's like, well, it's taking time.
Because we're better than a hospital. So, if Brad and I can fix just about anything
Except for
a broken heart.
but these knee glides are not going to help. The
No,
broken
I can
heart.
see that. Not at all.
I don't think. I'll work on that.
All right. Thanks for watching.